Most seniors think they know everything Medicare offers. They're aware of the basics, the hospital coverage, the doctor visits, maybe even the prescription drug plans. But what if I told you there's a little-known benefit buried deep in certain Medicare Advantage plans that can literally put money back in your pocket for everyday essentials like bread, milk, fresh vegetables, even cleaning supplies, and yet almost nobody uses it, not because they don't qualify, but because they don't even know it exists. And that's exactly how it's been for years, quietly tucked away, where only the most determined policy readers could find it. And the irony is, this perk was created to improve seniors' health by helping them eat better and live cleaner, but it's hidden behind so many layers of insurance jargon and vague paperwork that 95% of eligible people never claim a single dollar. And here's where it gets even stranger. When you do find out about it, there's often no big announcement from your insurer, no bold, you have grocery money waiting letter. Just a tiny line in your plan benefits booklet about an over-the-counter allowance or healthy food card, which might sound like it's for vitamins or supplements, but in reality, in many plans, it can be used at major grocery stores, dollar stores, and even online, and sometimes the amount is shockingly generous, anywhere from $25 to $100 per month, automatically reloading each month if you use it. Meaning that if you let it sit unused, you're literally leaving hundreds of dollars on the table every year. And the kicker is, many people who finally discover it have been paying for groceries out of pocket for years without realizing their Medicare plan would have covered a good chunk of it. And the reason most people don't know is because the insurance companies aren't exactly rushing to promote it. Sure, they mention it in the plan details because they're required to, but they don't send out flashy reminders or step-by-step guides, because from their perspective, every dollar you don't claim is a dollar they keep, and while they won't say that out loud, the lack of clear communication speaks volumes. But let's talk about how it works. Because this isn't some complicated reimbursement system where you have to mail in receipts and wait months for a check. Most plans that offer it provide either a reloadable card like a debit card or a barcode you scan at checkout, and the amount is automatically deducted from your allowance instead of your own money, and you can use it for eligible grocery items, over-the-counter medicines, and sometimes even home health supplies, which means this isn't just about food. It can cover toothpaste, laundry detergent, pain relievers, allergy meds, and a surprising number of everyday necessities, and yet because the benefit is so poorly explained, many seniors confuse it with food stamps or SNAP, and they assume they wouldn't qualify, so they never even ask. But here's the really wild part. This isn't some brand new program. It's been around in some form for years, quietly growing in scope, and now with competition between Medicare Advantage plans heating up, more insurers are adding it to attract members, but still burying the details in fine print, and it's gotten to the point where some people have gone literally years paying full price for their groceries while hundreds, even thousands, of unused dollars expired on their account every year. And I've heard stories from seniors who only found out about it because a cashier at their local grocery store mentioned the Medicare card when they saw them paying with cash. And after one phone call to their insurer, they learned they'd been missing out on $50 a month for nearly 2 years. Do the math, that's $200 that could have been in their pocket for milk, bread, and fresh fruit, gone forever. And while $50 or $100 a month might not sound life-changing to some people, to a senior living on a fixed income, that's the difference. Between buying healthy food or settling for cheap processed options, between stocking up on cleaning supplies or stretching a bottle of dish soap for months. And that's exactly why this perk exists, to make healthier living affordable, which in turn reduces healthcare costs for insurers. But none of that works if the people who need it most don't know it's there. And here's where things get even more frustrating. Sometimes when seniors finally try to use the benefit, they're told it's not available in their specific plan year, or they get stuck in endless phone transfers with customer service agents who seem just as confused about the perk as the members. And it's no accident that this confusion keeps usage rates low. And if you're wondering how to find out if you have it, the key is knowing exactly what to ask. Don't just call your Medicare plan and say, "Do I get grocery money?" Because half the time, the rep will say no without checking. Use the official terms like over-the-counter benefit or healthy food benefit, And ask them to check your plan documents for allowances that reload monthly or quarterly. And if they say yes, ask how to activate your card immediately, because every month you wait is money you'll never get back. And once activated, the best move is to treat it like real money. Use it early in the month before it expires, plan your shopping list around eligible items, and don't be shy about asking which local stores accept it, because the list is often bigger than you think, including national chains like Walmart, CVS, Walgreens, and even Amazon for certain items. And here's the sneaky part. Some plans only roll over unused benefits for 1 quarter, meaning if you miss 3 months, you lose it forever. So even if you're not in dire need of groceries 1 month, use it for things you'll need later, like toothpaste, bandages, or non-perishable foods, because unused benefits are essentially free money thrown away. And the heartbreaking truth is, this perk is hiding in plain sight, quietly shaping the financial stability and nutrition of the small percentage of seniors who actually use it, while the vast majority struggle unnecessarily. And if you think the government is going to step in and make it more obvious, don't hold your breath. Awareness comes from sharing the information, from telling your friends at church, your neighbors, your family, because every time someone learns about it, that's potentially hundreds of dollars they get back into their household budget. And the more people know, the harder it becomes for insurers to keep these perks buried under fine print. And here's the final kicker. If you're watching this right now and you're on Medicare Advantage, there's a very real chance you could walk into your grocery store next week and walk out with $50 to $100 worth of food and supplies paid for by your plan, and all it takes is one phone call to check. But you have to do it now, because every month that passes without using it is money gone forever. And if you're not going to claim it, you can be sure your insurance company isn't going to call and remind you. Now, let me tell you about the first time I actually saw this perk in action, because it completely changed how I look at Medicare Advantage plans. I was standing in line at a neighborhood grocery store behind an older gentleman named Harold, maybe in his late 70s, wearing one of those old baseball caps that looks like it's seen every season since the 1980s. He was unloading his cart: bread, milk, eggs, fresh produce, even some canned salmon. Nothing extravagant, just the basics. When the cashier told him the total, he pulled out what looked like a regular credit card and swiped it. The cashier smiled and said, "All covered, zero balance." Harold chuckled, thanked her, and started bagging his groceries. I couldn't resist asking, well, was that some kind of discount card? And he leaned in like he was sharing a secret and said, "It's my Medicare grocery card. Been using it for a year now, $75 a month, free groceries. Can't believe more people don't know about it." And it's not just Harold. There's Martha, a widow living on Social Security, who told me she found out from her neighbor in the apartment next door. Martha had been skipping fresh fruit because of rising prices, settling for cheaper, carb-heavy foods that weren't good for her diabetes. Her neighbor explained that she was getting $50 a month from her Medicare plan for groceries, and Martha almost didn't believe her. But after one call, she was approved. Now she says she hasn't gone a single month without using it, and her doctor has noticed her blood sugar improving, not because of some fancy medication, but because she can finally afford to eat better. So why do 95% of eligible seniors never claim this? The psychology is simple but frustrating. First, trust issues. Many seniors have been burned before by offers that turned out to be scams, so when they see something that sounds too good to be true, they ignore it. Second, information overload. Medicare Advantage plans send out thick booklets every year filled with technical jargon, and most people either skim or toss them. Third, lack of promotion. Insurance companies don't make flashy ads about this benefit because every person who uses it costs them money. And fourth, fear of bureaucracy. Some seniors think using this perk will involve forms, proof of income, or complicated qualifications, so they decide it's not worth the hassle. But here's the kicker. The system almost seems designed to make you miss it. Benefits are often buried on page 63 of a 100-page document in a single paragraph sandwiched between unrelated policy changes. The wording is vague. OTC benefit available for approved items at participating retailers. So unless you know that OTC means over-the-counter and that approved items can include groceries, you'd never guess it applies to everyday food. And the math is staggering. Let's say you have a $50 monthly benefit. That's $600 a year. If you've been eligible for 5 years but never claimed it, that's $3,000 gone. If you're in a plan that offers $100 a month, you've missed out on $6,000. And here's the thing. Most people don't realize that money doesn't roll over indefinitely. If you don't use it that month, it either expires or, at best, carries over for a short period before disappearing forever. This is not like a savings account. It's more like a use it or lose it gift card. The people who figure it out early treat it like gold. I've spoken to seniors who have an entire OTC shopping routine. They keep a running list on their fridge of eligible items they need: bananas, oatmeal, toothpaste, pain relievers, and on the first week of each month they go shopping with their Medicare card. Some even pool rides with friends who have the same perk, turning it into a little monthly outing. It's not just about saving money, it's about getting a small sense of control back in a system that often feels overwhelming. But the part that really gets me is how avoidable this ignorance is. Imagine if Medicare Advantage companies sent a big, bold postcard that said, "You have $75 for groceries this month. Spend it before it expires." Redemption rates would skyrocket overnight. But they don't, because unused benefits are pure profit for them, and they can still claim they offered it, satisfying regulations while quietly benefiting from the fact that almost nobody uses it. Now, here's where it gets even more interesting. Competition between Medicare Advantage plans is starting to heat up. Some companies are beginning to advertise these perks more openly because they know it can sway people during open enrollment. But even then, they often present it in vague terms: additional benefits for healthy living, instead of saying, "We'll literally pay for part of your groceries." Why? Because the more concrete it sounds, the more people will actually use it, which increases their costs. I've even heard of seniors finding out about this perk only after switching plans, meaning they could have been getting it with their old plan the whole time. Imagine paying your grocery bill for years, thinking that's just how it is, and then discovering you could have saved hundreds or thousands if you'd only known to ask the right question. That's why I tell people, don't wait for your insurance company to spoon-feed you this information. Call them today and ask, "Does my plan include an over-the-counter or healthy food benefit? If so, what's the monthly amount? What items are eligible, and where can I use it?" Then write down every answer, because vague responses are your enemy. And for anyone thinking, "Well, I'll just check next time I'm at the doctor," don't wait. Doctors usually don't handle insurance benefits directly, and by the time you remember, another month might have passed, along with another $50, $100 lost. The bottom line? This isn't just about free groceries. It's about breaking the cycle of hidden benefits that never reach the people they're meant for. The same mentality that keeps seniors in the dark about this perk is the same one that keeps them from hearing about cheaper prescription options, bill forgiveness programs, and other cost-saving measures that could drastically improve their quality of life. And here's the part you need to remember. If you're eligible, that benefit is already built into the premium your plan is charging. You've already paid for it. It's not charity, it's not a handout. It's your money, just waiting for you to take it back. So the next time you're at the grocery store, imagine walking up to the checkout with a cart full of healthy food, swiping your card, and hearing the cashier say, "All covered, no guilt, no second guessing, no wondering if you can afford fresh fruit or a box of cereal. Just the quiet satisfaction of knowing you've finally claimed what's yours." And here's the twist. This isn't the only hidden Medicare perk like this. There are others, some that pay for gym memberships, dental work, even transportation to medical appointments, and most of them fly under the radar, just like this one. But if you think the grocery benefit is shocking, wait until you hear about the one that can actually put cash back into your account every month without touching your Social Security check. And I just stood there thinking, how many heralds are out there, quietly enjoying this, while everyone else keeps paying full price? Here's the truth. Harold didn't learn about it from his insurance company. He found out by accident. He'd been at his pharmacy picking up a prescription when the pharmacist noticed a small note in his plan profile about an OTC grocery benefit and told him to call the number on the back of his card. 10 minutes later, Harold was registered, and the next week his card arrived in the mail. In that moment, I realized this perk wasn't just underused, it was actively hidden in the noise of Medicare paperwork.